Hi, this is Brian Wormers giving a lecture on hepatological disorders for medical surgical nursing at the University of Sioux Falls. So things we'll talk about today include cirrhosis, hepatitis, and steatosis, and then talking about liver trauma briefly. So cirrhosis is scarring of the liver. This could be a chronic reaction to inflammation and necrosis. Lennox cirrhosis is often related to alcohol and alcoholism, and hepatitis C can be a common cause related to, this infection. So what do we see with this one? So it's complications depends on the amount of the scarring in the liver and where it's at. If it's compensated, then the body can still perform the actual essential roles of that liver, but it can deteriorate. So, like I said before, causes alcohol, hepatitis, autoimmune, viral, fatty liver disease, drugs, toxins, gallbladder diseases, metabolic genetic causes, or cardiovascular diseases. So things that you might see would be changes in weight, GI symptoms, abdominal pain, liver tenderness, pruritus, itching. Late stages, so jaundice, you kind of see the body's yellow on this one. You can see as that liver gets very, very big, what you're going to also see are these wonderful little cappa medusa. And that's these kind of things. They look like those snake projections coming off of around the belly button. Spider angiomas in these pictures here. So factor hepaticus means foul-smelling breath. It smells like fecal matter. And amenorrhea, so they stop having their cycle. Might see gynecomastia, so breast development or bigger swollen breasts, especially like in guys. Testicular atrophy and impotence. Bruising, petechiae, and large spleen. Esophageal varices, because everything is getting backlogged and you're having all this pressure go out to the systemic vasculature. You might see neurological changes, especially as those waste products build up, including asterixis. Click on this video, but what you see is that they flap their arms kind of like a bird, so to speak. It's an involuntary action that they do, but as it progresses, you might see that they do some of that flapping of their hands. So diagnostic-wise, we're watching ALT, AST, and watching those liver enzymes. You might look at serum billium and protein and albumin levels and seeing what that's doing. You might look for prothrombin time to see what clotting is like. Look at platelet counts to see if they're bleeding anywhere, along with the H&H. You might look at ammonia levels, as this is a waste product that might get elevated if their body's not clearing it. And then once again, creatinine if their body's not clearing it. On CT, what we might see is a lot of internal swelling, especially of that liver. Might do an EGD, so scoping, and then might do a liver biopsy to look at the cells of that biopsy and see how much scarring there is. So as those pressures build up and as the waste products build up, when they get higher ammonia levels, what you might see is this portal systemic encephalopathy, and it definitely impacts fermentation. And so you get these bacteria on the proteins, liver can't convert it, and you get a buildup of ammonia, and that becomes toxic. And so ways that we try and treat this, of course, trying to moderate some of the amount of protein in their diet, so limit steaks and different things like that. Fat, simple carbohydrates, to try and decrease the ammonia that they'll make. Drug therapy, lactulose is often given. It's not as a softener. But oftentimes what we try to do is draw that ammonia in, and then it binds to it, and then they excrete it that way. Antibiotics, I suppose the other thing that I'll do is it will give them a laxative effect, so the food that they are trying to digest doesn't stay in there as long, and so they will poop out the nutritional things as well, and not have to break this down. Antibiotics, once kind of a similar thing. Destroys that normal flora, so they can't break the proteins down, and if they can't break the proteins down, they're not going to get the waste product of the ammonia. Hepatitis, realize that this is liver inflammation, and irritation can be caused by lots of different things. Things to remember, like the vowels affect the bowels, so hepatitis A and E are usually fecal-oral route, where B, C, D are more bloodborne. And so all these affect the liver. There are lots of other types of here. You might hear G, TT, or SEN. But the main ones I want you to be aware of is A through E. But know which ones are bloodborne, know which ones are fecal-oral. What's it going to look like? Well, they're going to get abdominal pain, changes in eye or skin color with the jaundice, joint pain, muscle pain, constipation or diarrhea, fever, lethargy, nausea and vomiting, itching, jaundice, elevated liver enzymes. So what do we do with that? Well, try to get them to rest, both physically and psychologically. Provide diet therapy for them by giving them good foods to help absorb and digest. Giving them some medications, so if they have some nausea and vomiting, we might give them antiemetics. If it's a viral etiology, we'll give them medications like Sovaldi. Click on this one because Sovaldi is about $80,000 per course of treatment. While it clears it up about 95% of the time, should we be using this one, and what are the complications of using such an expensive medication? We might also use immunomodulators trying to calm the body down. We might use vaccinations like you all receive for your hepatitis Bs. So they do make vaccinations for hepatitis A and B. And so if you go to other countries, you might have to have the hepatitis A vaccine, which is usually a shorter lasting type of situation. And then push come to shove, if everything kind of fails and the liver gets destroyed, then of course a liver transplant might be warranted. Fatty liver, so this is caused by accumulation of, I'm not sure what happened with that. So you get accumulation of fats in and around the hepatic cells, and that's often linked to diabetes mellitus, obesity, high lipid profiles, and alcohol abuse. Many of these patients are asymptomatic until you start seeing a lot of liver destruction. And when the AST and the ALTs go up and the ammonia levels go up, then you're starting to see more of those hepatic signs and symptoms. Liver trauma. So liver is one of the things that can get damaged a lot. It is very vascular and it can bleed a lot. And so the bad thing about this one is it can go into shock because of that perfusion there. And so if we lose a lot of our cardiac output and a lot of our blood that way, that body can go deteriorate quickly. You can see some of the stuff on CTs and ultrasounds. Treatment would involve surgery if we have to. If we can try not to, it's better not to try and cut into this when the liver is angry and irritated and swollen, because it usually causes complications. But we'll treat it with fluid resuscitation and maybe even blood products if needed. That concludes this lecture on hepatic. If you have any questions, please contact me.